today we're very lucky to have Dr. Kathleen Camacho. She is a provisional psychologist with us at ORS, and her thesis is titled What Patients Do in Treatment Matters, an exploration of the dynamic nature of cognitive behaviour skills in an intensive treatment. And this was completed at Uni of Western Australia. So we're going to talk a bit about some of Kathleen's research and maybe some of the clinical applications.
Thank you.
Can you tell us a bit about the aims of one of your studies?
So this particular study in my thesis is kind of the second study that we mainly did. The aim of this particular study was to look at whether we could predict how CBT skills that patients use in a very intense 2-week treatment, how these skills affect both well-being and symptoms at different points in treatment. Because it was sort of a question about, well, as a person gets better, do they tend to use their skills more? So we kind of have this correlation of, well, what happened first? Or is it that because they are using their skills, they become better in treatment? So that's why we kind of looked at it in 3 different chunks in this particular study. We looked at the skill use and the symptoms at the beginning of treatment, the skill use and the symptoms and well-being at the middle of treatment, and then the skill use at the very end of treatment. So that was sort of the overall aim of this study.
Can you tell us a bit about some of the key findings?
Yeah, so some of the key findings of this paper in particular was that what we found was that the CBT skills actually predicted future outcomes rather than the other way around. So if a person applied more CBT skills, they would experience a higher well-being and lower symptoms, rather than if somebody's well-being and symptoms changed, that their CBT skills would change. The other interesting thing that we found in this paper was that the changes in well-being caused by the CBT skills occurred early in treatment, whereas the changes in symptoms that were caused by the CBT skills occurred later in treatment. So they almost seem to be a 2-step process in this treatment outcomes where there were changes in well-being before there were changes in symptoms. It's raised a lot of questions as to, well, why does well-being occur? Why does this change in well-being occur earlier compared to a change in symptoms? And I think a part of what we sort of think is that the well-being tended to measure positive aspects of your life, like engaging socially, whether you're being active enough, whether you feel as though you're doing things that interest you. And I think the early parts of treatment really do focus on increasing the person's well-being. And I think they really do focus on trying to get the person more engaged in their life and what's going on. Whereas the later part of treatment, I think more focuses on those symptoms that are really, really core to depression and anxiety. Sometimes the skills that you may use, you might have to try a few times for it to feel a bit of change in the symptoms rather than well-being. I feel like the well-being change you kind of get instantly, but the symptom change I think takes a little bit of trial and error to do, and you might need a particular quality of skill that may take a few times for you to do, a bit of feedback from your clinician about how to actively focus on changing your symptoms. But those were the 2 main things that we found in this study. One was that your skills do change your symptoms and well-being first, and the other is that well-being and symptoms seem to change at different time points in treatment.
I mean, it makes sense when you look at a generic CBT program with a lot of focus on the psychoeducation, on improving sleep functioning, and really looking at maybe just some of the basic things that are important in someone's well-being to begin with, and trying to restore some of that functioning before targeting the symptoms through cognitive restructuring, through exposure therapy and whatnot.
Yeah. And another thing that we kind of thought as well is because there is that break on the weekend, so it's the 5 days at the beginning, there's a weekend break, and then 5 days at the end, that this weekend break is probably a really significant time for a lot of clients to be trialing a lot of these skills to test a lot of their symptoms. It's their first few days away from the group as well. It's their time in their normal environment where they would be experiencing a lot of these symptoms and negative automatic thoughts and maladaptive coping skills. So we do also think that that is a really key time for patients to be using their skills to challenge their symptoms. So that's also another thing that could be going on in the background as well. Yeah.
Do you have any recommendations for those implementing CBT in terms of ways to maximize the uptake of CBT skills and also ways to maximize clinical outcomes.
Yeah. So to sort of maximize the uptake of the clinical skills, I think it's really important that clinicians do actually start tracking the patient's well-being and symptoms throughout treatment. So they can kind of look at, okay, well, the last 2 sessions, your well-being was doing really, really good and your symptoms were slowly decreasing. But today you're presenting a bit differently. What was going on in between this session and last session? What was a bit different? So I think it's really good to be tracking the actual outcomes that you really want to focus on because, like I said, symptoms start to change a bit later in treatment. So if that's all clients are focusing on, then I wouldn't feel encouraged to continue using the skills if I wasn't seeing improvements. But if we also had a score of well-being and we could show them, hey, look, your well-being is slowly getting better. You might not be aware of it because you're too focused on what's going on over here, but your well-being is getting better. I'd feel a bit more encouraged. So that's the first thing. I would definitely recommend that clinicians start tracking their symptoms a bit better and the well-being. The other thing is, I would also recommend that they start tracking the CBT skill use. In this particular study, we focus on 3 parts. We focus on the use of the CBT skills, like how frequently they're using it in between sessions. We also focused a bit more on how confident the patients felt using these skills, and if the patients themselves thought the skills were effective, like for that particular task. Those 3 things I think are really, really important, and previous studies in my thesis sort of show that when you do include these 3 measures, your prediction of post-treatment outcomes increases just a little bit. So it's really important to measure these 3 things because the patient perceptions of the CBT skills are really important to explore. If I don't feel confident using my skills, or if I don't feel as though they're effective in doing what I want them to do, I'm most likely going to stop using them if there's not somebody who I see weekly who's checking up on me. So I think it's really important to measure those things, and they can kind of go hand in hand with the daily measures that we have of symptoms and well-being as well, because you can kind of say, look, for these past 2 sessions when you were doing really well, you seem to be using your skills quite a bit, but your confidence stayed really low, your perceived effectiveness stayed really low, and then so that's probably why on day 3 your scores are looking a bit worse than what we were expecting. So let's flesh out these barriers that you have with your confidence and effectiveness as well. So that's kind of the recommendation I would make to sort of keep clients using their CBT skills and to try and get them to maintain it, is by really tracking their progress in treatment and their own perceptions of the CBT skills, so we can sort of flesh out the barriers. So those are the 2 main recommendations based on this study that I would make to clinicians.
Beautiful. Thanks so much, Kathleen, for sharing your research.
Thank you so much. I've enjoyed this. Thanks.